Imagine this. You're living your life like normal. But suddenly you realize something's not quite right. That confidence, that performance, it starts to fail. And in the search for solutions, one name keeps popping up. Whether at the doctor's office or all over social media. Tadalafil. But what is Tadalafil really? Is it safe? Does it actually work? Is it only for erectile dysfunction? What about side effects? Can you take it every day? And hey, is it true that it even boosts gym performance? If you're looking for clear, straight answers backed by real science, stay with me until the end of this video, because today, you're going to learn everything you need to know about Tadalafil. Let's start at the beginning. Tadalafil is a medication that belongs to a class called PDE5 inhibitors, which stands for phosphodiesterase type 5 inhibitors. Sounds complicated, but the way it works is actually pretty simple. It relaxes blood vessels, allowing blood to flow more easily to certain areas of the body. In practical terms, this means firmer, longer-lasting erections. But hold on, Tadalafil does way more than just that, and you're about to find out. Here's something really important to understand. According to studies published in the British Journal of Clinical Pharmacology, Tadalafil doesn't actually increase sexual desire. It's not about libido. It only improves the physical response to sexual stimulation. That's key. And check this out. Unlike other medications in the same category, like the famous sildenafil, Tadalafil has a much longer duration of action. We're talking about up to 36 hours. That's why it's sometimes nicknamed the weekend pill. But is it only for erectile dysfunction? Nope. In recent years, research has shown that Tadalafil offers surprising benefits for other conditions too. One of them is benign prostatic hyperplasia, or BPH, the enlargement of the prostate that often happens as men get older, causing urinary problems. The FDA has already approved Tadalafil for treating this condition, and it doesn't stop there. Studies suggest it can also improve overall circulation, help with pulmonary hypertension, and may even support heart health. A study published in the European Heart Journal revealed that patients using PDE5 inhibitors, like Tadalafil, showed a reduced risk of certain heart events, of course, when used appropriately and under medical supervision. Now, let's talk about a topic that sparks a lot of curiosity: Tadalafil and gym performance. Can it really boost your results in the gym? Well, this is a hot debate. Tadalafil does indeed promote vasodilation, meaning it improves blood flow, which theoretically could help muscles receive more oxygen and nutrients during workouts. Some athletes and fitness enthusiasts even report better endurance and a more noticeable muscle pump. But here's the truth. So far, scientific evidence is still limited. Some studies, like one published in the Journal of Applied Physiology, did show improved oxygen delivery in elite athletes, especially in high-altitude conditions where oxygen is lower. But listen carefully. This doesn't mean Tadalafil is some kind of workout supplement. It's still a prescription medication, and its use should always be guided by a doctor. And of course, it's not all sunshine and rainbows. It's like any medication, Tadalafil can cause side effects. The most common are headaches, nasal congestion, back pain, muscle aches, and sometimes digestive discomfort. Thankfully, most side effects are mild and temporary, but something a lot of people don't talk about, because it's a vasodilator. Tadalafil can lower blood pressure, especially when combined with alcohol or other medications that also affect blood pressure. And trust me, that can be dangerous. Another serious warning. It's absolutely contraindicated for people taking nitrate-based medications for heart conditions. Mixing the two can cause a massive drop in blood pressure, so severe, it could be life-threatening. That's why, and I need to emphasize this, never use Tadalafil without a full medical evaluation. It doesn't matter if it's trending online, if your buddy recommended it, or if you saw someone hyping it up on Instagram. Your health is serious business. Now, you might be wondering, what's the difference between using Tadalafil as needed versus taking it daily? Good question. When used occasionally, the typical dose is 10 to 20 milligrams. It's taken about 30 minutes before sexual activity. But for daily use, the dose is usually much lower, between 2.5 and 5 milligrams per day. This is designed for men who prefer to maintain spontaneity in their sex lives without needing to time the medication. Here's something even more interesting. Many doctors are prescribing daily Tadalafil not only for erectile function, but also to improve vascular health, support prostate health, and even as a preventive measure in certain cases. But like I said, this needs to be individualized. What works for one person might not work for another. And that's exactly why medical supervision is non-negotiable. Now that you know all this, ask yourself, do you really need Tadalafil? Are there other factors in your life that are affecting your sexual health? Think about it. Sedentary lifestyle, chronic stress, poor diet, alcohol, lack of sleep. All of these have a direct impact on your sexual performance. And sometimes just fixing these things is enough to solve the problem without any medication at all. So, before rushing to the pharmacy, take a hard look at your own routine. Are you truly taking care of your health the way you should? If this video helped you in any way, drop a like to support the channel, hit that subscribe button, and turn on the notification bell because here we deliver real, science-based, no-nonsense content about men's health and performance, and tell me in the comments. Did you know about all these benefits of Tadalafil? Got any questions? I'll see you in the next video.